Hi, my name is Anandhini Narayanan, and I'm working closely with my peer, Stella Iskandarian. We are both third year medical students at New York Medical College under the supervision of our dean, Dr. Etienne. Today, we want to introduce a unique healthcare topic in medical education titled Health and Justice, creating effective partnerships with justice involved populations and medical students. I first wanted to provide some background for those who may be unfamiliar. There are 2.3 million people currently incarcerated in the United States, and this disparately includes ethno-racial minorities, low-income communities, and LGBTQ+ communities. Compared to the general population, those who are incarcerated are at an increased risk for infectious diseases, chronic diseases, substance use disorders, mental health issues, have increased rates of suicide, and shorter life expectancies. It is important to think of the health of incarcerated individuals not just as an isolated issue. Rather, this impacts everybody. Families and loved ones of those who are incarcerated also have adverse health outcomes. And when those who are incarcerated are released back into their communities and are lost to follow up, this then negatively impacts community health. The children of those who are incarcerated also face higher rates of adverse childhood experiences, and it is economically more to keep someone incarcerated than to provide adequate rehabilitation services. So we must start to contextualize incarceration as a social determinant of health. Other medical school curricula have focused on creating either rotational experiences or didactics with justice health involvement, but this doesn't allow for an equal voice and empowerment for those on the inside. So we wanted to change this and create a unique opportunity to also help empower those on the inside so they can have a greater say over their own healthcare. We wanted to provide a roadmap of how to start with this different educational experience. So we first surveyed our students. We wanted to find out how many students are interested. Do they have any previous involvement with incarcerated populations or have any prior knowledge in correctional health? And we found out that 81.9% of our students, years M1 through M4, had no previous experience with justice health. You then want to mobilize your resources. Some questions you want to ask are: do we have medical school faculty with justice health experience? Do we have students from all 4 years for longitudinal implementation? How can we partner with neighboring correctional facilities? And we actually were able to partner with a neighboring correctional institution, Westchester County Jail, who has a long history of providing educational opportunities for those on the inside. Now, incarcerated individuals often not have had the privilege to access education, and education on the inside can actually decrease recidivism rates. Then you want to think about, well, how am I going to facilitate this course? And this is where the inside out training becomes really crucial. Educational opportunities for those on the inside can be very detrimental if not done right. And this is why the Inside Out program was created years ago to help facilitate educational partnerships between higher education institutions and correctional institutions. So, us as medical students are often given an equal voice to our faculty or administrators, but then we're partnering with a correctional institution where there are unequal power dynamics, and those on the inside are given no voices. So, we don't want to think of this course as, well, we're coming in and we're helping the knowledge of those on the inside. Rather, we want to think of this as a very equal basis of opportunity. So the Inside Out course helps to develop curriculum, they help set parameters, and they help navigate institutional relationships. And it's largely embedded in solidarity, anti-exclusionary, and anti-oppressive practices, offering the same learning opportunity to each student. Then you want to create the syllabus. What is your syllabus going to look like? What healthcare topics are you going to touch upon? And then you want to check the validity of your course. And this is going to be done through pre and post course surveys, including detailed questionnaires regarding knowledge assessments and reflections and perceptions and attitudes about justice involved populations. So historically, healthcare in the correctional facilities has largely been relegated to doctors who have either lost their license or, it was kind of their last choice. And we want to change that. We want our students to critically think and evaluate what their unconscious and conscious biases are towards these populations so that we no longer have suboptimal care. Then you want to think about longitudinal integration. How can something like this be incorporated throughout our medical school curricula? So, in terms of our outcomes, we actually have a course set to take place next spring with fourth year medical students and Westchester County Jail students. And this is just a proposed schedule of what's going to happen. It's going to be a combination of both didactic and discussion based classes. And weeks 1 and 2 are just for our medical students, and it involves preclinical coursework and reading about the incarceral institution and how it disparately involves people of color. And we also want to think about how healthcare has historically been administered within jails and prisons. Then we're going to have a week about clinical skills and reasoning and physical exam and diagnosis for a justice involved patient. And weeks 3 through 8 is when we're actually partnering with students on the inside in Westchester County Jail. And we want to provide them with a list of topics to choose from. So we want them to kind of create ownership of their own educational opportunities. Are they more interested in learning about chronic diseases? Are they more interested in learning about mental health? What's going to help them the most when they are released and may not have that same follow up to care? Again, this is just educational opportunity to provide empowerment for those on the inside to help or maybe improve their healthcare knowledge and literacy. So, those on the inside largely don't have a choice of how healthcare is administered to them or what healthcare choices and access they have. So we want to, provide them with that kind of discussion of knowledge of, well, this is exactly what you should be looking out for. These are symptoms you should pay attention to. This is what you can do if you're not receiving this care. And then they can leave having more comfort and knowledge about what their healthcare issues are. So, again, this is different from other medical school justice health curriculums in that we are also providing individuals on the inside with an equal voice. And this is really essential to their health advocacy. When we're thinking about reframing what correctional health looks like, it's crucial to not forget involving those on the inside. This should also involve a partnership with incarcerated individuals so they can also empower themselves. And I just left our contacts. Feel free to reach out to us with any questions or ideas. We are always open to collaboration. Thank you so much for your time.